This is the beginning of patient assessment. This is the patient and this is the room in which we will be performing the assessment. Here are some of my tools I'll be using: hand sanitizer, coffee for smelling, and a dull and sharp object. This is the rest of the room. This is my son who will be filming the assessment for us. All right, great. Hello, my name is Charlene. I'll be your nurse for today. I'm going to be performing a head-to-toe assessment. Can you tell me your name, please?
YC.
Great, and your date of birth.
Day of birth.
And where are we right now?
The clinic.
Great, and can you tell me the month and year?
It's June 2022.
Excellent, so patient is alert and oriented and no apparent distress. All right, so like I said, we're gonna do a head to toe, so we're going to start with the skin, hair, and nails. I'm gonna take a look at your hair and I'm assessing for texture and distribution, which are both normal. I see no signs of apparent infestation. And now I'm just gonna take a look at the skin. Skin on the face looks normal. Maybe take a look at your arms. Normal, no bruises, lesions, or abnormalities. No edema bilaterally, and the fingernails are normal. I'm gonna take a look at your legs. Skin looks normal, no bruising, no lesions, no abnormalities, and no edema. And the toenails look normal as well. All right, so we're gonna start by inspecting the head and the neck. I see no signs of jugular vein distension. Face is symmetric. Eyeballs are clear, the sclera is clear, and the conjunctiva is pink. So no abnormalities there, so I'm just going to test Perla. So I'm going to shine a light into your eye. Great, thank you. Thank you. So pupils are round, reactive, equal, and accommodating, reactive to light. Can you follow the pen for me with your eyes? Fantastic, no abnormalities noted. All right, so if we were going to be performing a Snellen chart, we would have the patient sit 20 feet away from the chart, cover one eye and read the lines from top to bottom, cover the other eye, and then read the lines from top to bottom. All right, so next we're gonna take a look at the ears. I'm just gonna feel any pain or tenderness.
No.
I'm gonna feel the eyeballs as well, the lids, upper and lower, great. I don't see any signs of drainage or abnormalities, and they are symmetric. So I'm going to perform a whisper test, so I'm just going to whisper a word in your ear and I want you to repeat it back to me.
Cat.
Dog.
Dog.
Fantastic, thank you. All right, next we're going to move on to the nose. The nose is symmetric. I'm going to take a look in your nares. No occlusions, no abnormalities. May I have you occlude one side of your nose and blow out? And then the other. All right, patency in both nostrils. And I'm just gonna test your sense of smell. Can you tell me, close your eyes and tell me what you smell? Go. Awesome. All right, and I'm just gonna feel your temples. I'm just feeling for pulses in both temples, and those are normal and 2+. I'm gonna take a listen for bruise. No bruise noted. I'm also going to feel the carotid arteries 2+, and I'm going to listen for bruit. None noted. And I'm just going to put my fingers here in your jaw. Can you open and close your mouth for me? Great, and move side to side. All right, fantastic. Clench your jaw real tight for me, and then raise your eyebrows. I want you to close your eyes real tight, frown, now smile, now puff out your cheeks, fantastic, and purse your lips. Great. And I'm just gonna take a look inside your mouth. If you could stick out your tongue and say ah. All right, mucosa is pink and moist and not dry, no abnormalities, uvula is in the center. I'm also going to, if you could just have you stick out your tongue again, move it up, down, left, and right. Thank you very much. Alrighty, so I think I already felt the sinuses, but I just want to make sure we didn't forget to palpate the sinuses area. And I'm also just going to feel your lymph nodes under your neck, along your clavicles, and under your arms as well. no masses or lumps. And may I have you lift your arms, and I'm just gonna pretend to feel under here for any lumps or masses. Lymph nodes are normal. If we were to perform the gag reflex, I would take a tongue depressor and touch it at the back of the tongue to elicit a response. No abnormalities found there. All right, so next we're gonna move on to the musculoskeletal. All right, so I'm just gonna inspect all of your joints. So starting with the neck, nothing noted, and I'm gonna take a look at the spine. Spine is in line, no abnormalities. All right, we're gonna test the range of motion. Can I have you touch each ear to your shoulder as far as you can? The patient does have some limited range of motion on the right side due to a recent injury. Can I have you tuck your chin to your chest and then look up? Great, and then turn your head side to side. I'm gonna have you perform that side to side again, but I'm going to put pressure against. Great. Range of motion is normal except for the abnormality noted on the right side, and strength is 5 out of 5. All right, so now we're gonna test your shoulders. We did not notice any abnormalities in the joints. Can I have you extend your arms out and then push them back? And then we'll do adduction away from the body. Fantastic. And I'm gonna test strength. Can you shrug? And 5 out of 5 strength. All right, next we're gonna do the arms. I have you hold your arms out. We're gonna test strength and arms. Push against my hands. Push. Great. Strength 5 out of 5. And then I'm gonna have you flex your elbows and extend. Normal range of motion. And then do that again, but I'm gonna put pressure. Great. And push down. Strength is 5 out of 5. We're gonna do the same with the wrists. Hold your wrists out, point them down and up. And then I'm gonna have you point your fingers toward each other and then out. Great. And then we're gonna do the down and up once again, but with resistance. Great. Strength is normal. And just squeeze both of my hands. Thank you very much. All right, if I may have you stand, we're gonna check the spine next. I already have noted no abnormalities in the spinal area, so we're just gonna check range of motion. If I can have you bend forward. All right, that's great, thank you. And back, great. And then I'm gonna have you do lateral side to side, great. And then rotation, left to right. All right, range of motion looks normal. We're gonna do hips next. So to check the hip flexion, I'm just gonna have you bend one knee up at a time. Great, range of motion normal. And if you could have a seat again. All right, so we are going to check the knees. Knees look normal. Flexion, extend, please. Great, and you can put them back down. And then we're gonna look at the ankles. No abnormalities noted in the hips or the knees. Ankles look normal. I'm gonna have you point your toes up and then push them down. Great, in and then out. Extend your toes and then curl them. Fantastic. All right, and can you push against my hands? And push down, great. And I'm just gonna take a look at the toes, check capillary refill, less than 2 seconds. All right, so next we're gonna move on to the cardiac assessment. So I am going to listen. First I'm going to check all your pulses. We already did the temporal and the carotid, so we're gonna start with the brachial pulses. These are normal, 2+ radial. 2+ normal. We're gonna simulate checking the femoral pulses, 2+ normal. We're gonna check the popliteal, normal, 2+, and then we are also going to do the posterior tibial and the dorsalis pedis, which are all 2+ and normal. All right, so I'm gonna take a listen to 5 different points on your chest. We're going to do the aortic, pulmonic, Erb's point, mitral, and tricuspid. And I'm just listening for normal heart sounds of S1 and S2. Great, I've heard S1 and S2. I'm going to turn around to the bell side of the stethoscope and listen for any murmurs or abnormal sounds. No murmurs noted. We did check the capillary refill as well, which was less than 2 seconds. So heart is sounding great. So we're gonna move on to respiratory assessment. I'm gonna place my hands on your chest and I'm just checking for symmetry when you breathe. So I'm gonna have you take a deep breath. And checking for any phlebitis in the area, none noted. So next I'm going to percuss the chest. No abnormalities. We're going to listen to the back. Great. And then I'm going to take a listen. So I'm going to have you take deep breaths as I listen to all your lung fields. Lungs are clear anteriorly. Nice deep breaths. Lungs are clear in the posterior portions as well. All right, so I'm gonna have you come over here and get comfortable. We're gonna check the abdomen next. We're gonna pretend the patient is lifting up to expose our abdomen so I can take a look for any bulges or pulsations, any abnormalities, none were noted. So the next thing we are going to do is to listen to all 4 quadrants. We're gonna start in the right lower quadrant. Bowel sounds are present in all areas. Next, I'm going to check the renal arteries and the aorta as well as the femoral arteries for any bruits. No bruits were noted. We're going to percuss each quadrant. No abnormalities noted. And I'm just going to use a light palpation and you tell me if you feel any tenderness or pain. Nothing?
No.
All right, fantastic. All right, if I can have you sit forward, I just want to check for any CVA tenderness in the back at the costovertebral angle. So let me know if you feel any pain, pressure, or tenderness.
No. No.
Fantastic. All right, great. So Next, let's move on to the motor skills portion. I'll have you sit down. And I'm just gonna ask you to do a few things. I'm gonna have you start by taking one foot and running it down the opposite shin. Fantastic. And the other side as well. And then you can have a seat, take each finger and touch your nose. And for rapid movement, I'm gonna have you flip your hands over like this several times. Fantastic. Now if I could have you get up and walk to the couch, please. And then when you come back, if you could do a heel-toe motion. Excellent. Gait is steady and balance is steady as well. So if I can have you walk back to the couch, I want you to go there on your tippy toes and come back on your heels. Great. No abnormalities in the movement area. So next we're going to perform the Romberg test. This is part of the sensory assessment. So I see that you are standing here steady without any swaying or unbalanced. Now I'm going to have you close your eyes for 30 seconds and we're going to test your steadiness. All right, let's say 30 seconds has passed. No abnormalities swaying, no unusual motions or unbalance was noted. We will move on next to more of the sensory portion of it. So if I can have you have a seat. Next thing I'm going to do is test your sense of dull and sharp. So I'm gonna have you close your eyes. I'm gonna take an object. First, we're gonna start with your face. I just want you to tell me if it's dull or sharp. How do you feel?
Dull. Dull. Sharp. Sharp.
Great, and next we're gonna do your arms. Let me know if it's dull or sharp.
Dull. Dull. Sharp. Sharp.
And we're gonna test the legs. Pull the legs out for me. Dull or sharp?
Dull. Dull. Sharp. Sharp.
Fantastic. All right, so you can close your eyes, keep your eyes closed. I'm gonna place an object in your hand. If you could just tell me what that object is.
Marker.
Fantastic. And then hold out your palm, keep your eyes closed. I'm going to draw an object in your hand. Tell me what it is I'm drawing.
Circle.
Fantastic. All right, so I'm going to test commands next. So we already tested your alertness and orientation, so we're moving on to attention next. So I'm going to have you count backwards from 100 by sevens for 1 minute.
193, 86.
That's great, stop. We'll pretend that the patient did that correctly for 1 minute. So attention, no abnormalities found. Next, we're gonna go to comprehension. So I'm going to tell you to do something and I just want you to follow commands. So I'm gonna hand you this marker. I want you to take it with your left hand and place it on the floor. Great, thank you. Patient follows commands, comprehension intact. So next we are gonna test short-term and long-term memory. For long-term memory, could you please tell me what you did for your last birthday?
Went to the beach.
Fantastic. And for short-term memory, I'm going to tell you 4 words, okay? And I want you to remember those 4 words. The words are dog, cat, blue, and sock.
Dog, cat, blue, and sock.
Great. We're going to wait for 20 seconds. 20 seconds has passed, and I'm going to ask you to recall those words for me.
Cat, dog, blue, and sock.
Fantastic. That concludes our assessment. Thank you very much for participating today. I appreciate you. End of assessment.